And then the very serious girls in the back and up front, we've always got every time Zion, Nasa, Jenny, and and Clara. Always in the front, always working hard, usually working hard. But I've really enjoyed working with Zion. She's got a great topic, a topic that even as a biologist working on a PhD years ago, organoids were not around when I was working on my PhD back in those days. So it's kind of new for me, very interesting to read. Zion says, first of all, I would like to thank God for leading me through life, even when I had no idea what I was doing. Thanks to Mr. Wade for your patience, especially when my drafts arrived months late. That's true, but that's true for a lot, right? Mr. Felix, thank you for fixing my mess of a flow, even though your schedule is basically fully booked forever. Also, to all the teachers who have helped me through this process, to my parents, thank you for your endless support and prayers. I promise I ate and slept sometimes. And to my friends, thank you for being my emotional support. Sorry for the late night rants and sudden disappearances. Love you all. Zion's title, I'm supposed to say this in a certain way, and there's no way I'm going to do it right. It's like, thank you, next.
Aww.
Why should science choose organoids? Give me just a second, Zion, to get the timer set up, and I'll let you know when you can start. All right, you can start when you're ready.
You are diagnosed with a terminal disease. You're just waiting and waiting for the new treatment. It is in development, but it could take years to reach human trials. Why? Because before it ever reaches you, testing a certain drug must pass through mice, monkeys, and countless other animals that frequently fails to predict human responses. Now, what if, instead of years for an unreliable result, scientists can test the drug on a miniature version of your organ called organoids? These organoids represent your organs, allowing scientists to test treatments quickly and accurately. Would you believe it if I told you this technology exists today? So then, why are we still relying on outdated, costly, ethically questionable animal testing? Why waste this technology when we can harness it to save people's lives? Science have tried to replace animal testing for decades, but only recently have organoids shown real promise. In the 1980s, studies found the cells can organize themselves and grow in 3D, especially placed in a gel-like materials like Matrigel. These tools gave researchers the foundation for researchers to grow mini organs from stem cells. A breakthrough came in 1981, when scientists first isolated mouse embryonic stem cells. Then, by early 2000s, scientists used this knowledge to cultivate human tissues from the lab. They were already growing mini organs, all called organoids, from adult stem cells. They started with intestines, then soon moving on to brain, lungs, livers, and kidneys. Animal testing had always had its limits, mainly because animals do not respond to drugs or diseases like humans do. Organoids made from human research, human tissues, can provide us how diseases work on human tissues and how drugs might affect our body without putting anyone at risk. For example, liver organoids have helped scientists study drug-induced liver damage, something animal testing often fails to predict. Before we dive in, let me clarify what I'll be talking about. When I say animal testing, I'm referring to the use of living, non-human animals like mice, rats, monkeys, and dogs in use in experiments to test drugs, cosmetics, chemicals, and medical procedures. This includes everything from injecting cancer cells to mouse to observing how monkeys respond to new vaccines. Now, what exactly are organoids? In simple terms, they're tiny, 3D structures made from stem cells that can organize themselves into mini organs. They're not really fully organs, but they act as the real one for scientists to test various types of experiments on it. They've even helped us to understand how mutations happen over time, around 40 a year depending on the organ, and how that might lead to diseases like cancer. Organoids are also proving useful in studying infections. Guts and lung organoids, for example, in genetic diseases, can be grown from patient cells. This lets researchers see how someone might respond to a treatment in moving us closer to personalized medicine. A good example is cystic fibrosis, where patient-derived organoids help identify which drugs are most likely to work. In cancer research, doctors can grow patient's tumor as an organoid and test treatments directly on it. That way, they can see which drugs will work the best before giving them to the patients. This personal approach avoids trial and error. Organoids are even being used in regenerative medicines. In one study, science corrected a gene defect in a cystic fibrosis organoid, restoring its function. Cystic fibrosis is a gene disease where a gene called CFTR is faulty and blocks the chloride channel, making gut and lung mucus thick and harmful. Researchers restored normal chloride water transport by CRISPR, correcting the faulty CFTR gene in a patient's intestinal organoids, directly confirming the mutation's harm and gene editing's therapeutic promise. New diseases like COVID-19 have shown how badly we need better, quicker, and ethical research tools. Organoids meet that need. They're quicker, more accurate, and don't involve animal suffering. But they also raise new questions, especially around ethics, consents, and data ownership. As we build more biobanks and use more stem cells, we must ensure that we're doing it responsibly. For centuries, scientists have asked us to trade lives, animal lives, for progress. But organoids offers different path. They're helping us study diseases in much more humane ways. And while the technology isn't perfect yet, the potential is enormous. The future of research doesn't have to be cruel. They can be wise, precise, and life-giving. Throughout this speech, I'll argue that it's time for science to break up with animal testing, not just because it's ethically questionable, but because organoids are the better match for human biology. In short, organoids provide more ethical, accurate, and human-relevant alternative to animal testing and should fully replace it in biomedical research. As for now, I'll be walking through 3 main reasons why organoids are a smarter choice. They're more scientifically accurate, cost-efficient, and more humane. Organoids have become more complex and functional thanks to the development of 3D bioprintings and microfluidics. In 3D bioprintings, scientists can position various cell types precisely within scaffolds to mimic human tissues. These setups recreate key interactions, improving organoids' structure and realism. Microfluidic systems keep organoids healthy by constantly feeding them nutrients and oxygen. This means fewer dead cells and better growth. With this technology, organoid became even more realistic. These innovations address earlier problems in nutrient diffusion and structure, creating more realistic tissue models. Organoids are reshaping medical research as they come closer to mimicking real tissues. One study on cancer showed a 92.3 match between organoid predictions and patients' chemotherapy outcomes. Organoids have revolutionized personalized medicine by tailoring treatments to the individuals. Growing patient-specific organoid lets scientists test drugs responses in advances, as seen in other cancers. Animal models can't account for human genetic diversity, making them unreliable predictors of drug responses. Their success rate is only 30 to 40%, while organoid shows much higher accuracy. This makes organoid useful not only for common diseases, but also various rare conditions that variability matters. Animal research is expensive and time-consuming, while organoids offer a cheaper and more scalable alternative. Organoid biobanks, curated collections of patient-derived mini-organs, lets researchers test thousands of compounds on human-like tissue before clinical trials too. Organoids make treatments safer and more effective, saving both time and money. They respond much faster to genetic changes than animal models. What takes mice months can happen in weeks with organoids. This speeds up drug discovery and help researchers act quickly on new findings. They make it easier to study such unique cells under controlled conditions. Researchers can observe cell diseases behavior and test drugs in the human-like environment. For example, some special human cells, like motilin plus endocrine cells, which are found in our intestines and help control digestion, aren't found in the mice in the same way. This makes it difficult to study certain stomach diseases using animals. But organoids can include these exact human cell types, so they give scientists a much more accurate way to research digestion problems and find better treatments quickly. Organoids provide better detailed data that animal models usually can't. They make it easier to test many drugs at once and let scientists see how cells behave, which genes are active, and what proteins are made. All in one place. This helps researchers get clearer and more accurate results. With multiple variable observable, scientists get insights that animal models can provide. Organoids from human tissues offer better predictions on infections and drug toxicity. They allow real-time observation at the cellular level, leading to safer treatments. Animal testing costs a lot. Housing, feeding, and caring for animals isn't cheap. Organoids are easier and cheaper to grow in a lab dish. They also help catch bad drugs early, so we waste less time and money. Because organoids closely mimic human tissues, they help predict toxic side effects that are missed in animal research. Liver organoids, for instance, have flagged harmful compounds that animals didn't. Organoids reduce the suffering linked to the animal research. If you're entering pharmaceutical research hoping to make life-saving discoveries, you might be shocked with the reality of real animal testing. Many scientists wonder whether it's truly necessary or is just deeply rooted tradition. That's where organoid technology offers hope. Like many researchers today, you realize that progress doesn't have to come at the cost of compassion. Animal research has long been standard, but it causes pain and often violates ethical norms. Organoids meet specific and moral standards. They follow the 3 R's: replacement, reduction, and refinement. Ethical principles that guide human research. This makes organoid both scientifically effective and ethically sound. Organoid research also matches global ethical guidelines, like those of the World Medical Association. Scientists can now study diseases and create therapies without compromising moral values. This builds public trust and supports ethical innovations. Organoids remove the need for controversial fetal tissue in research. Ethical issues around consent and dignity raises with fetal tissue, especially from abortions. But now, scientists can take normal adult cells like skin or blood cells and turn them back into stem cells. These are called induced pluripotent stem cells. They can then grow into almost any cell type in the body. This means researchers can study diseases using human cells without needing of animals or embryos. This makes research more ethical and human relevant, and also enables researchers to model diseases without relying on ethically sensitive materials. Organoids have already been used to study organ development and genetic conditions ethically. Their consistency and reproducibility also makes them a dependable alternative. However, we need to address that the ethical boundaries of certain organs are more obscure, like the brain, for example. As brain organoids grow more complex, they raise concerns about potential consciousness. These structures replicate brain affective and functions, and as the complexity increases, so does the ethical risk. Current bioethics doesn't fully address this concern. Some brain organoids have already shown activity like that of a developing brain. While they aren't conscious yet, scientists must prepare for the possibility as brain organoids grow more complex. Ethical rules must evolve to keep pace. The World Medical Association calls for dignity and respect in all research, including the organoid research. To keep brain organoids research ethically and morally aligned, researchers must establish rigorous oversights and review processes that addresses concerns from the outset. Since organoids come from donors who consent to their cells being used, their use is humane and responsible alternative for animal testing. Regulatory frameworks have helped ensure that organoid research remains ethically sound. Some people worry that using human cells might feel invasive. But organoids are made from cells given through informed consent, just like when people donate blood. No person is harmed in the process. Instead, this approach helps reduce harm by replacing animal testing. It's a way to preserve both science and human dignity. Others argue that low-resource countries can't afford organoids research due to more pressing healthcare needs. Yet, long-term, organoids can reduce drug development costs and help make healthcare much more sustainable. Partnerships between developed and developing nations showed us that collaborative research is beneficial to everyone. Organoid models can also be tailored to endemic diseases, improving healthcare for diverse populations. Organoids have matured into more human-like, increasingly complex, and precise human disease and drug testing models. This is a departure from animal testing, as organoids will reduce extenuating circumstances that lead to failure and take away the ethical dilemmas surrounding fetal tissue. We, as society, can move forward with advancing pertinent medical innovations with scientific soundness and moral integrity. It's not a new phenomenon that innovators have grappled with the moral implications of their acts. If field of medicine continues to foster economic advances while removing the moral underpinning issues, it is in danger of being inhumane in seeking an outcome. Ultimately, wisdom is being evaluated not on how much distance we cover, but how we cover it, in terms of suffering less while not being inhumane. Organoids provide us the opportunity to build towards scientific progress with our moral compass, but we must act how to stop future devoid of regard for shared humanity in our innovation. A laboratory will not push for change. We require a public voice. Supporting cruelty-free research sends the universal message that science should reflect the social values of the society being served. Empathic support should not be a roadblock to progress. It just needs to be a choice. We can wisely choose today to support the next generation of medical innovation that is congruent with the commonalities of our human condition. And when we do this, we co-create tomorrow where healing does not mean hurting. So, let me ask you again. You're still waiting, but now we face a choice that goes beyond science. Do we continue to allow millions of animals to suffer and die, caught in a slow and uncertain process? Or do we choose a kinder path, where treatments are tested on organoids, making them more hopeful without harm? This isn't just about progress. It's about compassion, respect, and the kind of future we want to build together. Which future will you choose? Thank you.
Good job, Zion. Our panelists today are Ms. Pepin and Ms. Amanda. We'll let Ms. Peeping go first this time.
All right, are you ready? Okay, congratulations again for finishing your thesis speech.
Thank you, Miss.
And I also I'm very appreciating you for tackling this topic because this topic is complex, and I would imagine how you read the paper because I was assisting Casey in doing her research, and then even I cannot read some of the paper is like so much foreign and like yeah, sometimes it's just not very readable for usual our human language. But yeah, so I appreciate you for coming this far and then making the paper. It's a good. Congrats. And I would like to ask, um, why did you take this topic?
So, first of all, thank you for the question, Miss. First of all, I chose this topic because one of my family members is a researcher in the United States. And I've asked, while searching this thesis topic, I've asked her if is there any problems going on that is controversial that can be used for my thesis. And she really addresses this point about organoids, that animal testing isn't really well shown as their research, their result. Because animal models are very different with humans. Especially mice is only like 85% congruent with human. But then still that 15% is a big difference. So my family member, she gave me this idea of organoid so I can talk about it in my thesis. Yeah.
Okay, thank you. Continuing from that, that's very interesting. So, if for example, some of your friends wanted to, or if you want to further going to organoids, like into the research of organics, usually what type of jurusan? What major do you take? Is
What
there any
major?
university or major that you take
To study
Study
organoids.
organoids, yes.
I would say biotechnology is the best way to, when you want to study more about organoids, because they really relate to technology, especially like the 3D bioprintings and microfluidics is developed from biotechnology. So I believe that rather than chemistry or pharmaceutical science, the best major to learn organoids is biotechnology. I mean, the name is already organoid, right?
Yeah. That's interesting. Okay. And how is it? So you were talking about yang 3D printing. I just want to know: is it possible to make these organoids and then translate it to? Is it already possible, or it is not yet done?
Sorry, transplant back to
For
the
example,
human.
you make the liver organoids and then you transplant it into another human being.
So far, actually, organoids are not really fully organs. They're just some kind of cell from certain organs. So even though they grow, they cannot specifically fully grown to be a functional organ. So technically, no. But in future, probably yes, because nowadays the technology advancement is going wild. I believe that with this technology advancement, organoids can also one day become organs, artificial organs.
Okay, there's only also one thing that I want to confirm. Is this different from 3D printing? Is this apa namanya? Apa sih namanya? Organoids. Is this organoids is different from the 3D printed organs?
Oh, so I haven't really researched on 3D printing organs, but then with my knowledge, organoids are basically, so far, not really fully organs, as I stated before, but 3D printed organs are actually organs, right? That can be transplanted back to human. But then organoids are not quite as advanced as that organs, so I would say no, but it is in a similar kind of aspect.
So is this apa namanya? Planted in growth in petri dish or some
Yes.
kind of gel
Yes.
gitu ya. And then I want to ask like how does it differentiate is the cell? So you said that it is from one cell and from the stem cell, and then do they differentiate the
Replicate.
function? Not only replicate, So like kayak meristematic cells will only duplicate kan. But after that, the next step is to differentiate. So some of them will have like a different function.
Yeah.
If there's no,
Yeah.
yeah.
So far as my research, I would say no, because that liver, that certain organoid, for example, from liver, is taken out and put in the petri dish, right? And then it will replicate and act as the real organ, but it won't develop more than that because it needs to be in a certain environment, certain temperature, and some things from our whole body. For example, like hormones that can lead them to differentiate, something like that.
So in our liver only, or for example, I don't know much about liver, but I do know about, for example, kidney. Kidney, there are a lot of different cells in it. Right? Do you just take one type of stem cell and then it becomes all of these different cells, or it's just like, for example, if you want to try it on the like the epitel of the liver, the epitel of the kidney, and then you just try it on that. So it's not the whole thing. It's
Yeah.
it's not the whole. It's
Organ.
not dynamic organ. But I read here it is like something that said that it is also dynamic. It
It is
also
also,
shows.
sorry?
It also shows like dynamic. Dynamic what? I forgot. Sorry. Dynamic response to the treatment or something. Wait. That I forgot. But yeah, it's just one. So you have to take just one type of cell, and then it will replicate, or it can differentiate itself into another type of cells in that one organoid. This is my concept.
As far as my research, the scientist will limit the organoids from differentiating to other. I think it is possible. It is possible
yeah.
for cells to differentiate into different kind of cells. But then I think the scientists will limit it because what we want is from that certain cell, certain organoid. Yeah.
So we're not looking at the connection between this one cell and this one cell.
However, there is a connection which is called organoids on chip, which is how to connect different organoids, for example, from liver and from like brain, so we can connect them with hormones and something like that.
Oh, whoa. Okay. Thank you for the good answer. And then ini, I want also to ask. You said that for the donor, it has to be there has to be a legal consent. And then I want to ask, what are the ethical matters that what are the concerns regarding why do you have to get this consent? Like, what is the worst case that can happen to
The worst
the
things that happen.
donor? Yeah.
So first of all, when I said consent, it's more to like when you donate your blood. So it's basically you go there and you donate your blood, and that's it, right? And you have consent that people can use your blood. Same as organoids, the consents are given from the donors. And I would say the disadvantage of that consent is commercialization, where companies or other individuals can use that organoids to profit for themselves. Maybe that's the biggest disadvantage.
Oh, so you cannot like apa? For example, like do something kayak like replicates. Never mind. I cannot. Okay. Maybe the last one I want to ask is, why is the animal testing is still used until now? Like if they already have organisms has been used like clinically. Some of them has been using all white gitu. But why does the animal testing is still used? What are the reason?
Thank you for your question. I would say, first of all, animal testing has been banned in USA and Netherlands in 2022. However, researchers still use animal testing because it's more like a deeply rooted tradition, where it was tradition from long time ago, and people are really used to animal testing, right? And they're new to this organoid thing too. So I would say that to reduce that, the importance of my thesis is to emphasize and also raise awareness on organoids. So people and researchers, especially in Indonesia or any other countries, developing countries, can use this technology.
Maybe they are like it is like the standard.
Yeah.
Okay, thank you.
Okay, Ms.
Okay.
Amanda?
All right. Okay. Thank you, Zion, for the explanation. And I think Ms. Pippin took most of the questions. No, thank you. Okay. I just want to ask is there any rules and regulations related to the organoids producing or even up until testing?
For now, the only regulations, you mean the government, right? The
Yes.
regulations from government is only about banning the animal testing. So they encourage the people, the researchers, to use other alternative than animal testing. However, since organoid isn't really old technique, it's quite new. So there is not much regulations from the government. But I would say that government still allows it because it's one of the alternative of animal testing.
Okay, thank you, Zayan. That explains. And then the second question is, you explained that organoids is now used for drug testing,
Drug
right? So is there any potential use of organoids? For example, can you design like a mutation for the organoids just to like to imitate a certain kind of mutation and something that is more than drug testing?
Thank you for your question. As stated in my thesis before, there is a gene editing technique called CRISPR-Cas9, which is basically to cut some part of the gene and like change the actual function. And I believe that is possible for organoids because there is one study that have restored its function of cystic fibrosis organoid by the CRISPR-Cas9 technique. So I would say reversing is also possible to not just restore the function, but change it to mutate to something else.
Thank you. You actually have answered my next question, so which is reversing the mutation. Yeah, thank you. And then last question is, what are the potential misuse of this organoid development?
I would say the first thing, like I said to Ms. Pippin, the commercialization of personal use. So even though biobanks have regulations and other rules that prohibits people from taking organoids as their personal profit, but still, since there is like corruptions and stuff, I would believe that many companies that is related to pharmaceutical science also use these organoids for themselves only. So I think that's the biggest misuse. It should be used for everyone and every researchers, but then the one who holds power, the biggest companies, would just take over. Yeah.
Ms. Pippin saw something on my screen. And throughout your research for this thesis, what is the most prominent biblical view that you found in this thesis?
Firstly, I would say it's that we're trying to save people's lives, right? First of all, because we need to love each other, as God said. And I really think that saving other people's lives is a big impact to the whole world. So organoid research should be more spread out since it's much more efficient and it's much more better than animal testing, but many people don't know. So I believe that the biblical perspective is basically that we love each other to save people. And we use these organoids to save people too. Yeah.
Thank you, Zayan. Good job.
Good job, Zayan. I have a few questions as well. So, as Ms. Pippin was pointing out, the kidney, for example, is not a simple structure, right? It's not a blob of kidney cells, right? It's got, it's created, it's composed of nephrons and there's gradients of sodium and things like that are established within the kidney. So, if I'm testing with kidney cells, probably organoids that are using kidney cells, certainly you can't make the complexity of a kidney. Is that right?
Yes. I would say yes. However, what I emphasize on my thesis is more to that animal testing should be abolished and changed to organoid and shift to organoids, because organoids are, even though it's not perfect, it can still be a better alternative than animal testing. Like such animal testing cannot fully show that it's similar to human, and even though that kidney cells that you have stated, kidney cells cannot represent the whole complexity, even though that has a bit of a disadvantage, but it's much better than using animal testing. So I would say it is possible. Yeah, it is. Yes, I would say that organoids aren't perfect, but it is the best alternative.
Okay, so my argument to that might be this, is that, sure, if I want to tell whether a specific type of kidney cell is, causes cancer when exposed to some new drug or something, I can get it. But if I'm lacking in my model the biosynthetic pathways or the organ systems that a living animal has, then it seems like I'm missing part of the test, right? So in other words, for example, there are some organs that secrete hormones or different kinds of enzymes and things like that. And your organoid model is certainly not going to be able to do that, I would assume. And so how do you fully test without a complete set of organ systems connected in a body, right, like an animal, right? How can you? Don't you think you still need animal testing to some extent?
To answer your question, thank you for your question, Mister. To answer your question, actually, I would go against your assumption, because my research, as I researched, I realized that organoids have advanced, and there is this certain technique called organoids on chip, and also there is many other neurons and other brain organoids that are used. So basically about the hormones and stuff, it can be reduced, the misunderstanding can be reduced by that technology, organoid on chip, where liver, kidney organoid and brain organoid and other organoids like pancreas that secretes hormones can be tested together. So it is in a stimuli kind of thing, yeah.
And if the whole idea really is interesting, that if before I take some new drug, you could actually test that drug on my cells. That would be incredible, right? So that we know how I personally would react. But it also seems like you have to test it on a lot of different organoids that would come from me, right? So I can't imagine what kind of drug we might be testing, but you might want to test it on a liver cell, a brain cell, a kidney cell. What do you think about that? Is that the way it should work? Is that you would test it on many different organoids from me if you want to personalize it for me?
I would say yes. It's depending on the diseases that you're going through. If it's really, really extreme and you cannot take any medicine, doesn't suit you, I believe that way that you have stated to take all different types of organoids is working. It should be done. However, if the diseases or like the things that you're going through is minor and like milder, I would say, I believe that only taking few, like almost 1 to 2 organoids is enough.
Okay. And I think I have another question. So, yeah, are there any studies right now? I know you kind of mentioned some data, and I'm curious, have there been any studies that actually compare directly testing on organoids versus testing on animals for directly, right?
Yes.
Comparisons.
Yes. There is actually in my research, one of the researchers it's published in NIH, where the direct comparison between animal testing and organoids are shown in tables. So I would see it's more like it's seenable, and I understand, which which from there I came up with that the mice usually takes months or to almost 2 years, but then organoids can take like minimal 2 weeks, but like if can it could also take days.
Yeah, really interesting topic. Thank you, Zion. Time is over. You did a great job. Excellent job. So what we'll do now, we'll meet with friends, family, panelists, advisor, if the advisor's here, and then we'll get some photos here, and then we want to start in 5 minutes with our very last thesis.